Let's begin the quiz. Take a moment and think carefully. When the world faced COVID-19, it wasn't just a health crisis. It was a global stress test. So here's the first challenge for your mind. What do you think was the most important lesson humanity learned from the COVID-19 pandemic? Pause for a second. Think about hospitals, borders, scientists, and everyday people. The answer is this: the pandemic showed the world how essential global cooperation truly is. No country could solve it alone. Early detection saved lives, rapid vaccine development changed the outcome, and strong public health systems became the difference between control and chaos. Preparedness is no longer optional, it is survival. Now, let's move deeper. People often hear the words epidemic and pandemic used interchangeably. But here's the question: what actually separates a pandemic from an epidemic? Take a breath and think. An epidemic refers to a sudden increase in disease cases within a specific region or population. A pandemic, on the other hand, crosses borders and continents. It spreads globally, affecting multiple countries at the same time. COVID-19 became a pandemic the moment it could no longer be contained within one area. Let's test your understanding further. Here's another powerful question. Why are vaccines considered one of the most important tools in preventing infectious diseases? Think beyond just injections. Vaccines work by training the immune system before danger arrives. They teach the body how to recognize and fight harmful pathogens without causing the disease itself. This prevents widespread transmission, protects vulnerable populations, and dramatically reduces severe illness and death. Vaccines don't just protect individuals, they protect entire communities. Now imagine life during lockdowns. Masks, distance, empty streets, closed schools. So here's the question: how exactly do public health measures like mask wearing and social distancing help during outbreaks? Pause. Visualize how viruses move. These measures reduce transmission by limiting exposure. Masks block droplets that carry viruses. Social distancing reduces close contact, where infections spread fastest. Together, they slow down outbreaks, protect healthcare systems from collapse, and save lives while treatments and vaccines are developed. Let's end with the most challenging question, one that affects the future. Why is achieving global health equity so difficult, even after everything the world has learned? Think globally. The challenge lies in unequal access to vaccines and medical care, weak healthcare infrastructure in many regions, poverty that limits prevention and treatment, widespread misinformation, and political barriers that slow cooperation. Until healthcare access becomes fair and universal, global health security will always remain fragile. And that concludes the quiz. If you were able to follow, reflect, and understand these answers, then you're not just informed, you're thinking like a global citizen.